I'm Senator Ayesha Farooq, a member of Pakistan's Upper House of Parliament. Since the last 4 years, I've been leading the polio eradication initiative in my country as Prime Minister's focal person on polio eradication. And I'm very happy to be here at the SBCC summit. I made a keynote speech this morning in the morning plenary on what worked for Pakistan polio program, how did we successfully shift norms and affect behavior and attitudes to bring about a turnaround in polio situation in my country. And later on also sat through as panelist in one of the panel discussions which revolved around some key innovation that the country program, polio program had made that could be used as a lesson for other development agendas worldwide. Well, Pakistan was finding it difficult to access and reach every child inside every house back in 2013-14. This is a time when the percentage of missed children was very high for the program. So we made a paradigm shift then to look at, instead of the percentage or number of children the program was able to cover, to number of children that the program was missing. And as a part of that strategic shift that we made, we also decided to experiment with hiring community-based vaccinators, predominantly women who were local, belonged to the same community and thus were trusted. So these CBVs that we employed in our hardest to reach areas of Gadab town in Karachi, Chaman in Kila Abdullah, in Khyber Peshawar, they are able to access inside homes. They're able to register, track and vaccinate children, even the children who are in the mother's lap or sleeping inside the house, guests that are visiting, children on the move. So we've been very, very successful in thus greatly reducing the number of children that we were missing earlier. And right now statistics are testament to this innovation, where the Pakistan's polio cases have gone down to just 8, where our missed children are less than 1% of our targeted population. You know, when I was appointed Prime Minister's focal person for polio eradication back in November 2013, the year following my appointment, Pakistan reported one of the highest number of polio cases ever in its eradication history, 306. When the world reported only 317, so we accounted for more than 80% of the polio case burden in the world. And it also meant that 306 children of my country were permanently paralyzed, permanently disabled. I think that was a turning point for me personally. It's now a passion. I see how with various interventions and innovations that the program has made, starting from the political commitment that we see at the highest level, where my Prime Minister is leading the effort, and this oversight and commitment trickles down at the provincial level, where the Chief Ministers and Chief Secretaries are leading the polio eradication initiative from the front. We have created emergency operation centers where the government and all partners in the polio program sit together as one team under one roof. Here is a program now that is completely data driven. It is scientific and based on scientific and evidence based decision making, where the program collects a lot of operational data, a lot of research data. We are monitoring and learning all the time. It also boasts today of the largest polio surveillance network in the world, where we are able to detect a virus in a timely manner as we move ahead. We feel bad news today is good news for the program in the long run. And of course, a very committed force of 260,000 frontline polio workers who trek the length and breadth of my country despite all challenges, whether it's climatic challenges, hard, difficult terrain. Security was a challenge some years back, but they're doing a very tough job. by knocking on every door in Pakistan in a typical national immunization drive. And all this effort, this capacity, this resolve, this commitment of the polio team, starting from the frontline workers to our area in charges, our supervisors, to district administration, provincial governments, the federal government, really inspire me and keep us motivated and keep us going. And of course, the progress that the program has made is very, very inspiring. The last mile is certainly proving to be very difficult. It has been a rocky road, but it's keeping us motivated and inspired to keep going, to sustain the momentum till our job of complete polio eradication and polio virus interruption is not finished. All our polio partners, whether they are implementing partners, whether there are donor countries here, which includes WHO, UNICEF, BMGF, Rotary, CDC, USAID, DFID, forgive me if I forget any names here. We're all working together as one team, which is led by the government. As I said, all decision making is done on scientific basis here, and there has to be good reason for all the innovations that have been made in the program. So yes, all these partners have been very key in providing us at times financial assistance, technical assistance, helping us with operational research. All these input are into the operations and communications aspect of the program and help us do our job even better. I think it's been delightful to be here, to be attending this summit. I've sat through some very interesting sessions where we've had some insightful discussions, stimulating discussions to see how SBCC works, especially for me in a polio setting. So countries who've interrupted polio virus transmission, countries like India, like Nigeria. We heard from Ukraine today, what challenges they're facing in complex situations, and what interventions can be used that we can apply in the Pakistan polio program, what lessons have been learned elsewhere, so that we do not reinvent the wheel, but we can learn from best practices of other countries, which we are doing all the time. So it's continuous exercise of learning. The environment is changing. Pakistan is a highly populous and dynamic country with evolving socio-political and socio-cultural challenges. So this summit has really provided an opportunity of how various SBCC techniques can be used in my country, and not just for polio. I'm taking home from here ideas to use interventions and innovations relating to SBCC in other development fields and agendas also.